Hi, I'm Dr. Fiona Caryl and I'm a research fellow at the MRC CSO SPHSU at the University of Glasgow. And my research, what it focuses on is trying to identify social and spatial inequalities in health promoting and health harming features of our environment and how this impacts our health and leads to health inequalities. So this is whether living in an area with lots of good things like blue and green space offers different opportunities for health than living in an area with lots of bad things like alcohol, tobacco, fast food, gambling. And I'm particularly interested in the experience of children and what they are exposed to on a day-to-day basis, and particularly in relation to the unhealthy commodities like alcohol and tobacco. Well, this is concerning when we consider that children are growing up in areas that might be harmful to their future health. Now, children are particularly vulnerable to what's around them. It's during this time, this development period, where ideas, beliefs, attitudes and behaviours are locked in for life. So we already know that there are twice as many outlets selling alcohol and tobacco in deprived areas, but this is not really telling us what children experience in their day-to-day lives. So we were able to use GPS data from spaces to see exactly where children move in their daily lives. This told us not only where they visit, but also the routes and paths they choose to get there. And importantly, it showed us how frequently and how long in terms of time they were exposed to outlets selling alcohol and tobacco during the day. By accounting for daily movement patterns, the GPS data showed us that inequalities in exposure to alcohol and tobacco retailers that children experience are much greater than what we expected. That children in deprived areas were 6 times more exposed to tobacco outlets and 5 times more exposed to alcohol outlets. So what the GPS allowed us to see is that existing inequalities in the distribution of outlets becomes much more exaggerated when you account for children's mobility, so where they move, where they spend their time, and particularly because children spend so much time close to their schools and close to their homes. We were surprised to find that most of the exposure comes from small shops, such as newsagents and convenience stores, but also from supermarkets. And we could look at the temporal trends and see that the peak exposure occurred just before and just after school. Stakeholders have told us that they really want to understand the link between exposure of children to unhealthy commodities and the use of these products as they grow up. Finally, stakeholders are also really keen to understand how much of an impact the visual environment makes. So does seeing marketing and advertising in streets and shops, as well as the products themselves matter? You know, do we need to put products like alcohol in age-restricted areas or even behind screens like we already do with tobacco? Our future work will address some really important evidence gaps about how exposure of children to unhealthy commodities influences the age that they start experimenting with those products, but also how likely they are to use those products in adolescence and young adulthood.